The Mental Health Spectrum Part 5, Anxiety Disorders, or response patterns, as I call them. If you've been following the series, you'll know I prefer the phrase response patterns, just because it makes more sense. Anyway, my name is Jesse. Welcome to the channel, Open Source Owners, where we talk about what if humans had an owner's manual, and definitely we would understand anxiety disorders as part of that owner's manual. Now, anxiety disorders or response patterns. So the or response patterns part refers to my predilection to connect mood disorders, anxiety disorders, and personality disorders really, really strongly with attachment theory, attachment style, and ultimately attachment wound, which form by the age of 2. So these attachment patterns are not your choices, and that's why they're basically a response pattern to the environment that you grew up in. But they then become solidified as a map in your brain, a mental map of how people are, and ultimately how you are vis-a-vis people, so how you relate to other people, and which types of patterns you have, response patterns you have. And then later, those get formulated, in my opinion, not everybody agrees with this, into what we then call anxiety disorder or mood disorder, etc. So there's actually an anxious attachment style called anxious preoccupied attachment, which actually, you know, if you think about it just even for a few minutes, it makes a heck of a lot of sense that somebody with a diagnosable anxiety disorder, which we'll talk about today, would actually have an anxious attachment pattern that they formed by age 2, and it has been following them and engaging through their behaviors and thoughts and self-image throughout their whole life. And they just may never have known it, right? So it's not like they're disordered, they're not a broken human, they're actually just have this pattern that keeps playing out that made sense then. It was a survival strategy at age 2. It made sense for the mom, the dad, the caregiver who was around at age 2, but now maybe it doesn't. Now it's causing, difficulties in the marriage or difficulties with your children or at work, etc. And that's where it becomes very useful to understand the origin story so that we can get into our psyche and then begin to reorient that origin story, change our response patterns. That's the definition of, at least the way I define the term responsibility, is it's our ability to respond differently to a similar circumstance. So the next time, normally maybe you yell when your husband says blah, blah, blah. Well, you have responsibility to not yell the next time, to do something else, to engage, to respond differently. That's where our power is. So with that framing, let's get into the anxiety disorders. There's not that many of them. And the most common one by far is the generalized anxiety disorder. This is the second most common diagnosis we see in the hospital, the number one being major depressive disorder. And often these two are together. Anybody who experiences these two types of disorders or response patterns will recognize that they're very often sort of like, yin and yang, just flown back into each other. Today's more of an anxious day. Today's more of an anxious based day. Yesterday was more of a depressive based day, that type of thing. These two things often coexist. And generalized anxiety disorder, or GAD, involves persistent and excessive worry that, of course, interferes with daily activities. It doesn't really matter if it's not really interfering with your life, I suppose, except it interferes with the quality of your mental weather, if we could put it that way. This ongoing worry and tension may be accompanied by physical symptoms such as restlessness, feeling on edge or easily fatigued, difficulty concentrating, muscle tension, problem sleeping. So it can go somatic. It can go into the physical body where you feel it very, very deeply. And then your doctor says you just have generalized anxiety disorder. And you go, well, what about my stomach pain? Or what about my muscle tension? That can't just be from anxiety. Well, it can be, actually. The other thing to say about generalized anxiety disorder is it could be a driver. One of the drivers of that could be from the biological domain. Forgive me if you already know this, but I tend to think in the psychological domain, which we're talking about now, the biological, like, whether you have appropriate amounts of minerals or nutrients or you have some type of toxin in the body, spiritual domain, so your purpose, your meaning, your connection to your soul, and then, of course, your social domain. Are you socially isolated? Are you engaged? What are the quality of your friends and family, etc.? The anxiety disorder can often come from the biological domain. That's the subject of another video. We'll talk more about that later, but keep that in mind, just like wedge that away. Most therapists don't talk about that because I find most therapists don't actually know about the biological drivers of mental health issues. Unfortunately, whatever reason that may be, obviously it's not in their training, and that's definitely true, but it's starting to happen, as we've talked about in other videos. There's such a thing now as a nutritional psychiatrist. The book, This Is Your Brain on Food by Dr. Uma Naibu. I think I got that right. I probably messed it up. She's a Harvard-trained nutritional psychiatrist. So this is coming into the foreground now. This is coming into the fold of psychiatry, which, by the way, a psychiatrist is a doctor of the soul. Psyche, it meant soul in ancient Greek. So a psychologist is as well. It's a doctor of the soul. So the soul is going to take all four of those parts. It's going to take the spirit, the psychology, the social, and the biological to really be functioning well. It's that balance that's critical. So anyway, I digress. Let's continue on. There's panic disorder. Okay, this is feelings of extreme terror that occur suddenly and without warning, and that is the key. It is not that you've been bubbling up with anxiety all day and then it spilled over into an anxiety attack. That's an anxiety attack. Panic disorder is out of nowhere. The panic strikes and takes you out. All of a sudden you're on the ground and you don't know what the heck happened, right? That type of thing. It's very extreme and it seems to be out of nowhere. Ultimately, when you get into doing the therapy work about your panic disorder, you will find triggers. You will find precursors to what actually like triggers off the panic. But it seems at first glance to just come out of nowhere. And of course, this is what it feels like. All the bad things, right? Numbness, dizziness, weakness, chest pain, rapid breathing. And then there are phobias. And now, of course, there's a phobia for everything. I'm afraid of grass. I'm afraid of leaves. I'm afraid of elevators. I'm afraid of clowns with blue noses. And I'm not trying to mock phobias. It's just that they get so specific. And there's hundreds and hundreds of the phobias. So you can explore that space on your own. But that, too, is often attached to attachment styles, attachment wounds, and particularly things like trauma. And then defensive mechanisms or response patterns to deal with those things that later became, out of control phobias. And phobias, of course, can be unpacked and sort of resolved if you go to the right therapist and you do the right sort of like self-care practices for those. Okay, so just a couple more on the anxiety disorders. There is social anxiety disorder or response pattern. The current Diagnostic Statistical Manual of Mental Disorders, DSM-5, differentiates between what used to be known as generalized versus specific social anxiety disorder by adding the specifier performance only. And that's the thing I wanted to point out here, meaning that a person only experiences this intense social anxiety when they're having to perform in some type of situation. And it looks like this: speaking to authority figures, so you had to talk to a cop or a judge, etc., going on dates, starting conversations, giving speeches. And giving speeches too, right? So that's social anxiety disorder. Just keep in mind that this one is, what sets this one apart from generalized is that it's very performance only. It's not like I always feel anxious. I'm anxious with my partner. I'm anxious with my kids. That's not a performance. That's my family, right? This has to do specifically with like workplace or some type of thing like that. Maybe starting to date someone when you haven't dated somebody, etc. And then the last one is separation anxiety disorder or separation anxiety response. Separation anxiety disorder is a specific psychological disorder that is different from normal separation anxiety that we all might have, like as our kids go to college or as our parents, retire. Like all those things can be hard for us to sort of adapt to and change with, but separation anxiety disorder is sort of specifically separate from that. Although it can be difficult to tell the difference between symptoms of separation anxiety disorder and generalized anxiety disorder because the symptoms overlap. So you might have headaches or stomach distress. Well, that doesn't sound any much different between separation anxiety and just general anxiety, right? Now, here's where it actually becomes a little bit more toward that separation anxiety. Excessive fears or worry that something will happen to either the parent or the child while the two are separated, and maybe flatly refusing to participate in separation activities. And then there's like inconsolable crying for the duration of the separation. So imagine a parent has a child who's going to college for the first time. Well, every parent is going to naturally feel like, oh my gosh, my baby's going, and they're going to cry and they're going to feel that separation anxiety. It doesn't become disordered until that parent is like, no, I'm not going to the graduation ceremony. I'm not going to take you to college. I can't do it. And then they're inconsolably crying for the duration, for weeks or days in a row. That gets us more toward the separation anxiety disorder side of things. And then age inappropriate separation anxiety in older children. So the kid grows up and now they're getting married and they're 35 or whatever, and the parent's like, I just can't believe I'm losing you, like inconsolable at the wedding, inconsolable when they have a kid. that's inappropriate for their age, right? The kid's probably sitting there going, Mom, I'm 35. Like, it's okay. We're not the same. We don't have the same relationship we used to have when I was a 6-year-old or whatever. Now, obviously, that indicates, again, attachment issues are clearly at the base of separation anxiety disorder, and that would be worth delving into the psyche, delving into the history. And you don't have to, you can do this in therapy, of course, but you don't have to. You can begin to do your own understanding of your own attachment formations, how those formed adaptive behaviors and adaptive responses at some point, but then they no longer became adaptive. And then we take the true meaning of the term responsibility, we take responsibility, our ability to respond, and we begin to change our responses to the familiar patterns in our life, more in accordance with our adult brain now, more in accordance with secure attachment features, which we can look up and study and model. Just write those down, read them every day, and then begin to practice them in your responses. And essentially, I mean, that's kind of the way that we can be our own self-healers. We don't necessarily need to offload this work on a therapist or on somebody else. This is sort of an inside job type thing. Now, it's useful to have help. It's useful to have support. So by all means, use therapy, go to different types of therapy. It's always my advice, though, if you're working with a therapist for 6 months or 2 years or something and you're not noticing benefits, you should demand a little bit more out of that therapist, or you should find a different type of therapy or a different specialist and see if you can get some movement. Time with therapists should result in benefits in your behavior or mood or your thinking. That it should have positive benefits. And if it's not happening, it's not necessarily that the therapist is bad or anything. It's just like, hey, maybe that's run its course and it's time to move on. It's time to find a different approach. There's a ton of approaches. One of the best approaches to healing from attachment issues or anxiety issues in this case would be internal family systems. So find a therapist who specializes in IFS, do some work there, and in 3 or 4 or 5 sessions, you should begin to really notice internal psychic changes that then you can carry with you the rest of your life and keep working those changes. Don't be afraid of this work. It's some of the most important work on earth. And at the bottom of it all, it's just you in there. The worst thing that you have to face internally is the bad things that you've done to other people or that have been done to you. That's the worst thing. But once you know that, it's not going anywhere. So we might as well get to know that space, get to know that dark underside of the rock, that ugly part of our psyche, and say like, hey, okay, I'm going to bring you back into the fold now that I'm an adult, and we're going to make it through this life together, and we're going to grow. We're not going to let that define us anymore. We're going to make it whole, right? And that's the definition of the term to heal. It comes from the root word to make whole. So healing in the psychic sense, in the mental health space, is just making whole again out of those separate parts of our psyche. In IFS, internal family systems, they call those the exiles. So bringing the exiles back into the fold, seeing where our managers are, and trying to communicate with those parts of ourselves. Okay, so I digress. That's the subject of other videos, like how do we do this work. If you haven't already, go ahead and download your free 60-page ebook called The Owner's Manual Part 2. Just click the link below. It'll come right to your email. That's just as a thank you for making it through this video so far. So go ahead and get that gift. That is yours. And that was the Mental Health Spectrum Part 5, Anxiety Disorders or Response Patterns. Now, there will be just one more part in this series, and in that one we'll cover the psychotic disorders, so schizophrenia, that type of thing. And with parts 1 through 6 sort of done, we're going to leave the diagnostic manual behind, and hopefully just these parts 1 through 6 will help orient the type of individuals that you've engaged with throughout your adult life. Most people with mental health struggles will be found in these parts 1 through 6. There are, of course, a million other diagnoses in the Diagnostic Statistical Manual, and you can go into that more specifically if you're really trying to hone in on exactly where you fall. But again, like I say, most people's struggles will fall into either parts 1 through 6. Somewhere in this range is where most people's mental health struggles lie. And then if we can tie those back into attachment theory and beginning to do the inner work of just sort of healing and repairing the attachment wounds and modeling secure attachment, we're halfway toward healing our mental struggles that we may have. And I know I make it seem easy, and I know that I don't mean to say that it is easy, but it's not all that complicated. You do have to focus on the 4 areas that I use. The psychic area, the psychological piece is what we're talking about here. Resolving the inner wounds, dealing with trauma, reattaching to a secure model, even within yourself, right? That's important. That's the psychological piece. But we're not going to get perfectly free from our mental health struggles if we don't deal with the biological piece, the diet that we're eating, the lifestyle that we're living, the water that we're drinking, etc. And then, of course, we need the spiritual domain to become part of our life's mission and our life's focus. And that would be things like purpose and meaning. And if you've lost purpose or meaning, actively trying to re-engage in purpose or meaning. And that's the spiritual domain, like making sure that your soul is satisfied with what it is that you're meant to be here for on earth. And then the last piece is the social piece. Are you isolated? Are you socially involved with friends who have bad habits? Are you socially stuck with family that is rude and unkind to you? What is your social milieu? And can you find and connect to tribes that are healthier and build you up instead of tear you down? If you do those 4 things, and you sort of cycle through them, and that's what my channel is all about, and that's what my email list is all about too. So get on my email list, and I'll walk you through a whole year-long program, basically, through the emails. But it's going to cover, and it's going to weave in and out of all those 4 areas. And as you continue to do that, what you'll begin to notice is a spiral upward dynamic of improvements in mental health. And eventually we get to the place where we're just simply resilient, anti-fragile, and stable in our mental health. And that's what I call sustainable mental health. That's the goal of my channel. That's the goal for everybody on earth, I think. That's my goal for everybody on earth, is to have truly sustainable mental health. And now, it's an inside job, but you can get support, you can get help. That's why channels like this exist. That's why therapists exist. So by all means, get help. But remember, it's an internal job. There is no pill that's going to do it for you. There is no magic surgery that's going to do it for you. But it also doesn't have to be, the hardest work you've ever had to do. It could be 10, 15, 20 minutes a day, continually cycling through those 4 big areas. And with a good strategist like myself, maybe on your side, trying to give you some step-by-step sort of approach to improving all these 4 areas, then, within 6 months, within 9 months, you'll see benefits if you take this seriously. So that's my promise to you. Join me in the email list. Go ahead and click that link below and get your free ebook, and that's where we'll connect via email. But also just stick with me on the channel here. Share it, subscribe, like, and most importantly, comment. So what are you learning? What has this made you think of? Do you struggle with anxiety disorders? Let me know. Has anything helped? And if not, maybe I can be of service. So on that note, thank you guys so much for watching this video. We'll see you in the next one, part 6, and that will be the last one in the series, The Mental Health Spectrum, according to me, Jesse. All right, y'all. I'll talk to you later. Thanks so much. Bye-bye.